Welcome, Chapter 9 on minerals, Part 2. Today we're going to cover the major minerals or the macro minerals. And then in Part 3, we will do trace minerals. Okay. So, minerals are the elements found in the Earth's rocks, soils, and other natural resources. And also plants contain minerals that they get from the soil or fertilizer. Animals in general obtain the minerals when they consume plants and other uh, sources of food. There are about 15 minerals known for functions of the body, and we're going to cover some of the major ones today. So, minerals cannot be synthesized by the body. We must get them through our diet. They are essential, and some minerals are um, processed out when of foods when we process them. Okay. So minerals are important. We need them. They are what we call cofactors. They are metallic ions or small molecules that activate other chemical processes. They make other reactions and chemical reactions in the body go faster, or they turn them on, I guess, in other words, by different methods. You see here the functions of minerals, bone health, nerve impulse, red blood cell formation, cellular metabolism is a big one that you see here, overall growth and development. Fluid balance is another big one that we'll talk a lot about. So, hormone production, where's that one on here? Such as your iodine, okay, needed for certain hormones to be produced. So, multiple factors here. Minerals are important. That's why we're going to be talking about them. You see, minerals are measured in milligrams or micrograms. We need the usual smaller amounts. You see here, and minerals also vary on their what we call bioavailability, the body's ability to absorb these minerals because of certain absorption factors. The need for minerals increases during growth aspects of life, such as infancy, puberty, pregnancy, breastfeeding, that kind of thing. And we get, like I said, minerals through our food that we eat. Okay, we get minerals. An area that's often overlooked is tap water. Okay, such as if you've ever had hard water, or if you have well water that may have been hard, you have smelled the sulfur in it. You've seen the iron deposit and calcium deposits build up. So those are good examples of tap water being a good source of minerals, or can be. With minerals, however, there is the possibility to have a toxicity to it since minerals have such a narrow range of what we call safe intake. It can be relatively easy to overconsume or consume a toxic amount of minerals, especially if you're taking these huge amounts of supplements combined with your diet and possibly combined with other types of environmental factors. Two that I used to see in clinical practice was hyperkalemia that would show sometimes as kidney stones or certain heart arrhythmias, or high iron, excessive iron, which it leads to increased oxidation and organ damage. Very rare, but it does happen. So something to be on the lookout. The first major mineral we're going to look at is calcium because it is the most plentiful. There's an excellent chart before we dive into calcium, there's an excellent chart on page 336, which is table 9.5, that covers pretty much all of the major minerals: calcium, sodium, potassium, magnesium, phosphorus, chloride, and sulfur, I believe, the big ones. So that is a definite good reference for you. Let's look at calcium, though, the most abundant. Okay, all cells need calcium, but more than 99% of your body's calcium is in the inorganic form that is in your bones and your teeth. And you see here why calcium is essential. You need it for bone development, bone maintenance, muscle contraction, blood clotting, in the form of vitamin K. It is the calcium ion is used for the action potential for nerve impulses, cellular metabolism, your hormone production, as far as the hormone calcitonin. Okay, calcitonin may produced in your thyroid gland, which helps regulate this overall bone development and maintenance, thanks to calcium. Let's dive in a little bit more here to the bone development aspect of calcium. You have bone cells that help build up your bones. Okay, these are osteoblasts. And then you have bone cells that help to tear down or reabsorb calcium when needed. These are your osteoclasts. So, this is what they mean here by bone development, the growth of it with your osteoblasts, and the maintenance of calcium level and the maintenance of calcium levels in the body with your osteoclasts. This is a delicate balance here between the osteoblasts and osteoclasts and overall maintaining bone health. Bone remodeling is constantly occurring in your life. Okay, it is constantly occurring. I thought I had a slide here of osteoporosis. And most of your skeleton is replaced about every 10 years. So this is why the bone disease, osteoporosis, which we'll talk about here in a minute, can be so prevalent as people get older. I want to dive in here, talk a little bit about this calcitonin production and how that works with your thyroid gland. So you see here how the thyroid and your osteoblasts and your osteoclasts help to maintain um, overall positive calcium levels. It's a pretty complex hormonal system here. Your thyroid and your parathyroid gland help to regulate blood calcium levels, and they are monitored through through the kidneys here. And you see this response. In response to falling blood calcium levels, the parathyroid gland, which is these little rice-shaped, these four tiny glands that are on the posterior aspect of the thyroid. That's your parathyroids. They, when calcium levels are low, they secrete your PTH, your parathyroid hormone, which in turn signals your osteoclasts to begin to break down bone tissue, and your kidneys recognize this. The calcium levels rise. All of this is working in conjunction with your vitamin D intake as well. And then high calcium levels after this calcitonin signaling, high calcium levels in the blood then stop this PTH production and thus kind of maintain calcium levels in the blood. Any that is high can get excreted in the urine, and it helps to maintain this overall normal range. Notice if everything is working correctly. So notice the kidneys here are very important. Where do we get calcium from? We get calcium from the highest bioavailability of calcium, obviously, is your dairy products. Okay, so the highest bioavailable calcium is going to be in your milk, your yogurt, your cheese, that kind of thing. However, it is also in various foods, such as you see here, kale, broccoli, spinach, but you need a lot more, as you see here. Okay, 1 cup of milk compared to 8 cups of spinach due to that bioavailability here. Some people also rely or do take antacids, such as your Rolaids, your Tums, those kind of things. But it is a good source, but yet again, it's not a good source. You don't want to end up relying on that. There are certain foods that are going to inhibit the absorption of calcium. In other words, decrease that bioavailability. And in other words, they bind to calcium and prevent its absorption in the small intestine. So these are your oxalic acids and your phthalic acids, such as certain whole grains, certain seeds and things. But in general, getting your calcium from your dairy products and your dark green leafy vegetables are good. And also, calcium supplements are also good, but you want to understand that calcium is absorbed in the small intestine, and so you need smaller doses. In other words, you can't just take a 2,000 milligrams of calcium in the form of Tums every morning and expect to be good. The body can only absorb about 300 to 500 milligrams at a time, and it's better if you take it with meals. Okay, it increases that bioavailability. So you don't want to, in other words, you don't take 2,000 milligrams at breakfast and expect to be good. You need to take several calcium containing foods throughout the day in order to reach the recommended daily allowance, 1,000 to 1,200 milligrams per day. Here you see for males and females, and that increases as, remember, we talked about some of those growth spurts areas, pregnancy, puberty, and so forth. When calcium is not absorbed, okay, and as people get older, it can lead to osteoporosis. Osteoporosis is hormonally controlled, or excuse me, calcium regulation, as we spoke about, is hormonally controlled. Osteoporosis is a chronic disease that is characterized by loss of bone mass and reduced bone structure, as you see here, normal bone structure compared to osteoporotic bone structure. And you see this typical hump back here. People with osteoporosis have weaker bones. They're at more risk for falls and fractures. And about 10 million Americans have osteoporosis, and about 43 million Americans are at risk for osteoporosis. It occurs in more often in females than males, and that has to do with the hormonal factor related to, well, being female. Okay. Females, estrogen and testosterone control that osteoblastic and osteoclastitic bone maintenance that I mentioned earlier. And in females, after menopause, hormone estrogen levels plummet, right? So when they plummet, you no longer have that regulation, and it leads to a decrease in calcium absorption, and it also leads to a decrease in those osteoblasts being able to build up the bone like they used to. And so remember, we said about every 10 years, the bone is going to kind of be replaced. Okay. Bone remodeling is always happening. So after menopause and year upon year of less bone ossification can lead to osteoporosis. So even in men, although men are always producing testosterone, so it's not as prevalent, but it does happen in men. Also, people of Asian ancestry, people with having a white or Asian ancestry, having a family history of osteoporosis, and then also smaller built people. So, how can you prevent it? Exercise, making sure you're taking calcium along with vitamin D. You need vitamin D in order to absorb calcium. You need your weight-bearing exercises, okay, such as low-impact aerobics, running, jogging, walking, dancing, yoga, strength training, those kind of things, not just sitting in bed, lying in bed, those kind of things. And I mean, swimming is great. Swimming is great for cardiovascular, but it's a what we call a non-weight bearing or low weight bearing exercise. So it's going to help great with cardiovasculature, but it's not going to help with overall bone remodeling. Second major mineral we'll talk about is sodium. Okay, sodium. Uh, Usually we know about sodium as table salt. That's the main type, your sodium chloride. There are other types, though. You have your sodium bicarbonate, which is your baking soda. You have monosodium glutamate, etc. But the major sources of sodium in the American diet are going to be the sodium we add. Okay, most foods are naturally low in sodium. It gets added as a flavoring and as a preservative that you see here in breads, rolls, pizzas, deli meats, those kind of things. Okay. However, sodium is very important. We need sodium in our diet. It's one of those essential cations, those positively charged cations needed for action potential in our body. That sodium potassium pump needed to transport things in and out of the cell that we talked about earlier. Muscle function, heart innervation, fluid balance. Okay, very essential. We talked a lot about sodium with our water video earlier. You have most people are not deficient in sodium. Most people are have the average American, excuse me, consumes over 3,500 milligrams of sodium per day. And that is a tremendous amount, okay, and very, very high. The as you see here, it's above the upper limits. That might be a bit high. 3,500 is might not be the average American, but it is in general, the average American is taking in above the recommended dietary guidelines here of 2,300 milligrams a day. And also, the average American is not checking their blood pressure, which is known as the silent killer. Hypertension is one of the risks of sodium, increased sodium intake. And I'm sure you know what blood pressure is, but blood pressure is where you're measuring the pressure of the blood against the blood vessels, okay, which is your diastolic, and then you're measuring the maximum pressure against those vessels when the ventricles are contracted. So systolic, the highest number when your heart's pumping, what is that pressure on the arteries? Your diastolic, what is that pressure when the heart is not pumping? Okay. Normal blood pressure, 120 over 80, give or take. Hypertension is categorized as 130 over 80. Okay, so anything above systolic of 130, anything above a diastolic of 80. It is about 46% of Americans don't know that they have high blood pressure, okay, because there's no signs and symptoms. That's why it's known as the silent killer. There is an excellent assessment on page 345 in your textbook. That is, I highly recommend you guys taking. It's where you answer 10 questions and then see what your score is for your overall risk of hypertension. Are you normal, elevated, or at extreme high risk? It's an interesting set of questions, and I highly recommend you take that just to look. Also, as we get older, hypertension is more prevalent. African Americans have a higher prevalence of hypertension. And obesity, and of course, smoking are the more common factors. And remember, we've been talking throughout the semester about how type 2 diabetes damages blood vessels, and that damage to the blood vessels causes them to be less elastic, damaged, and that can lead to hypertension. Okay, so diabetes really affects all aspects of the body. The next mineral we're going to talk about, the third major mineral here, is potassium. Potassium is another one of those positively charged ion in the intracellular fluid. It's like potassium, it does play like sodium, it does play a key role in maintaining overall fluid balance. Okay, so if your kidneys are functioning normally, like you see here, it's going to be integral in overall fluid balance. Potassium intake is known as the nutrient of public health concern. Most Americans do not get enough potassium, and that shows up in the signs and symptoms of headache, of possible migraine headaches, loss of appetite, muscle cramps, constipation. So, potassium does affect, like we talked about, digestion, overall kidney function, and there is a element to migraine headaches. Also, if your kidneys are not functioning well, then you need to really watch out for sodium substitutes. Sodium substitutes often have potassium as the mineral instead of sodium, or takes the place of most of it. But potassium is very hard for your kidneys to be able to regulate. So people with chronic kidney disease or kidney malfunction need to really watch their potassium intake. Our fourth mineral is magnesium. This acts as a coenzyme. And magnesium is really neat in the fact that it is responsible for more than 300 chemical reactions, or it helps participate in that. It helps to regulate normal muscle and nerve function, blood pressure, blood glucose levels. It's a really interesting study as to everything that magnesium does. It is part of it's in chlorophyll, okay, in plants. So your dark green leafy vegetables, your whole grains, your nuts, your beans, your seeds, these are excellent sources of magnesium. Your spinach, your pumpkin seeds, your baked beans, brown rice, those kind of things. So keep that in mind. Okay. Magnesium toxicity rarely occurs. So, I mean, unless you're taking massive amounts of magnesium supplements, which usually is not needed. Okay. And if you are suffering from migraine headaches, you might want to look at your magnesium levels. All right. Our last few minerals we're going to talk about are chloride. Chloride is a negatively charged ion found in the extracellular fluid. It's essential for that fluid acid balance that we talked about, base balance, nerve impulses, the production of hydrochloric acid in the stomach. And we mainly get that through our salt intake. Okay, sodium chloride. Wonderfully found in olives, celery, tomatoes, those kind of things too. And then lastly, sulfur. Sulfur is essential, or excuse me, needed to make the proteins, or to make proteins, and especially it's a component of the amino acids here that you see here, and also certain vitamins, biotin and thiamine. So it's an essential for many enzymatic activities, and part of that antioxidant molecular process we talked about earlier. So protein-rich foods are the best sources for sulfur in foods. Also, many wines will have sulfur or sulfites in them, and sulfur deficiency is very rare, but there again, it can occur with people who do not eat enough protein or do not or suffer from protein deficiency. Okay. In part 3, we will do another quick video on trace minerals. We just have a few more to go. So thank you. Hang in there.